For those of you who do withdrawal method, pull out game strong.
Today, our guest is an enlightened and very interesting young lady, popularly known as the Health Attainer. She'll be answering common medical questions asked about contraceptives today. So if I were you, I would grab my pen and paper because you might learn a thing or two from the professional herself. So ladies and gentlemen, join me as I welcome to the show the Health Attainer.
Yay.
How you doing?
I'm fine, thank you.
A lot of people know you as the Health Attainer. What is your name?
My name is Kelechi Okoro. Some people like to put doctor before my name, but that makes me a medical doctor, I guess.
So why is contraception important?
Okay, you know how Nigerians behave? We act like we don't talk about sex. We act like sex doesn't happen every day. But this is why we need contraception, because it's happening. So we need to prevent unplanned pregnancies. We need to do family planning, which is child spacing. And also, we know that sex is not just for reproduction, it's also for pleasure. So if you're not trying to reproduce, you need contraception.
What is a contraceptive implant and how does it work?
Just as the name implies, it's called an implant. So it's implanted underneath the skin of your upper arm. So it's just like a matchstick, really convenient to, place. It can be hidden so nobody sees it, and it's hormonal. So what it does is that it releases the hormone progestin gradually into your bloodstream, right? Mm-hmm. And what that does, it prevents your ovaries from releasing eggs. And also, it prevents the cervical mucus, right, from accepting the sperm. Okay, it makes it harder for them to move around and go to fertilize an egg that has been released. So that's how the implant works.
Is it okay to have it if you play a lot of sport, or could exercise cause the contraceptive implants to move out of position?
It's really rare, but in medicine we always say never say never. So it could actually move. But if you have vigorous exercises or you have vigorous physical movements or activities, then you could know when, of course, it's there, you know where it is, you know when it moves. So you have to see your doctor. Okay, so if you feel that it has moved, you need to see your doctor and get it replaced or see what can be done about it.
What is IUD and how does it work? And what are the different types of IUDs?
Okay, so IUD is basically intrauterine device. It means that it is put into the uterus. In case you don't know what uterus means, it's just the womb. So if you hear me say uterus, I mean the womb, right? So there are two types. One is called cyst-IUS, the IUS, which is the intrauterine system, and the other is IUD, which is intrauterine device. But they both contain different things, right?
Okay.
The first one contains progestin, just like the one I mentioned initially, and the second one contains copper ions. And what they do, the first one that has progestin, what it does is that it releases the progestin into the system, the bloodstream, gradually, and then it prevents you from releasing eggs. Yeah, you remember.
Yeah,
that's good.
I'm a good learner.
Yeah,
learner.
So the IUD that contains copper ions, what it does is that it stresses, it causes, the sperm will not be able to be mobile. They can't, move around and go to fertilize the eggs and all of that. So that's how that works.
Can the IUD travel from the woman's uterus to other parts of her body?
Ajala. Well, never say never in medicine again. It can actually travel, but it can't travel beyond the abdomen, the tummy. When I say abdomen, it's this area, right? Mm-hmm. So it can't travel beyond that. It can leave the uterus, and then stay somewhere outside the abdomen. But it's not a serious problem, right? Because you can notice it within the first 6 weeks. And if it's noticed, go back to your doctor. I keep saying this. Go back to your doctor, go back to your healthcare professional, and they get it removed. Okay? So that's how it works.
How much protection do condoms give against pregnancy? If a condom breaks, what are the risks of pregnancy?
See, most of you guys, you think you know how to use condoms properly. You do not. But for those of you who use it properly, you have 98% effectiveness, okay? For those who do not use the condoms properly, they have 82% effectiveness. That's for the male condoms. And for the female condoms, females are looking at me like, so we have female condoms? Yes, we do. So for the female condoms, it gives 95% effectiveness. But if you use it wrongly, it gives 79% effectiveness. So please know these things and know that you do not know them, and then learn how to do them, right?
All right, fantastic. So if a condom breaks, what are the risks of pregnancy?
First of all, one of the reasons why a condom will break is because both people are trying to overdo. For example, if you use 2 condoms at the same time, I don't know who does that, it could break, and then there's a risk of not just pregnancy, also sexually transmitted infections. So for the risk of pregnancy, you need to get emergency contraception. Go to Your Life. Your Life has everything that you need to know, or see a doctor to give you prescriptions for emergency contraception or something against the STIs.
How do birth control pills work?
Okay, so we have 2 types, and then they're called, one is the combined pill, and the other one is the progestin only pill. So the combined pill actually has 2 components, right? The progestin and estrogen. How it works is that it prevents the eggs if the ovaries from releasing the eggs. Yes. Oh, you're following. I like that. Okay, and then you take it every day, whether you have sex or not. Yeah. And then it's time bound, so you have to take it at the same time every single day. While the other one is progestin only. Okay, people who take that are those people who might react to estrogen. So how that works is that it's thickens the cervical mucus so that the sperm mobility is reduced, and then this also thickens the lining of the uterus so that pregnancy doesn't occur.
The next question is one that I would also want to ask. Okay. Would I add weight if I am on the pill?
Why are women so scared of weight?
Yeah, because there are a lot of people who add weight after taking it, and they say that's because of the pill and that. Yeah. So
okay, so we can't really trace it back to the pill. But for the purpose of this question, I'll just say that women have reported, to gain weight when they start taking the pill. And that's maybe because the pill increases their appetite. So when your appetite increases, you eat more, and then when you eat more, you gain weight. Then also there's something called water retention that comes with using those pills. Your normal periods actually cause water retention. When you're on your period, exactly. So you feel heavier, you feel like the water is retaining in your body. So that's the same feeling it gets. But this time around, you're taking it for a very long time. So that means you notice this feeling for a very long time, and then you start eating more, and then you start adding weight. But I mean, if the problem is the weight gain, there are other things you can do to actually regulate the weight. So if you know you're going on the pill, that means you need to increase your physical activity. You need to start exercising, and then you need to curb your cravings.
How do I know which contraceptive is right for me?
You have to know yourself and then ask questions. But first of all, you want to know, how many sexual partners do I have? If you know you're in a relationship with a mutually faithful person, then the only thing you're scared of is pregnancy and not sexually transmitted infections, right? So you could opt for the long-lasting ones, or the ones that have nothing to do with STIs. But if you know that your boo has another boo, which is very common, you should know you're trying to protect yourself from STIs and also from pregnancies. So you should go for the barrier methods, and at the same time, the barrier methods which are going to prevent the STIs, and also opt for the hormonal, the pill, the injections that will protect you from pregnancies. Also, what kind of person are you? Are you spontaneous? Are you organized? For somebody like me who is not organized at all, I know that I'm not going to be able to, stick to a regimen like
daily routine.
So I know exactly. So if you know that's the kind of person you are, then the long one is actually for you, because you know that if you have sex without protection, or you're trying to prevent pregnancy, then you have to remember to take the emergency contraception, or you have to take the short-acting one to protect yourself against pregnancy. So that has to be there when you're trying to choose the right contraception for yourself. And also, how do you see hormonal contraceptives? I mean, they're going to change your body. Do you like the way it's going to make you feel? So these are the questions you should ask your healthcare provider, and then they can give you answers, and then you can choose. For those of you who do withdrawal method, pull out game strong.
Look at them, look at all of them. They are not
See, if you're not ready for pregnancy, Don't try the pull-out game. Don't try the fertility awareness or the calculation. You need to be sure that if this comes, I am not going to get pregnant. So you should go for the long-lasting, the pills, the injectables, and the rest of that. So you should be ready.
What about people who are afraid of what the contraceptive would do to their menstrual cycle?
So you know that it's the hormonals that's going to get you there. So you are scared of that, then you should be thinking more about the non-hormonals, which are the condoms, the cervical caps, and the rest of that. So if you're not ready to get all those hormones going on around in your system, then that's the option that you should choose. I know you're not going to get everything from this video. That's why you have yourlife.com to answer all your questions.
All of your questions.
Exactly.
Contraceptives are important, and so are the various ways and methods. If you have doubt or you're unsure about the contraceptive that would work for you, or you're looking for ways to prevent pregnancies, make sure you seek advice from a medical personnel or medical practitioner. This is how much you can take on the Expert Health Show, brought to you by Bayer. My name is Rachel Isaac. See you guys next time.